During standard obstetrical ultrasound examination, several views are needed to image desired intracranial structures. These include the transventricular view, transthalamic view, and transcerebellar view. The transthalamic view is discussed here. On the left, a fetal head and ventricle system are drawn. The transthalamic view is an axial or transverse image of the fetal head. It is obtained at the level of the thalmi, shown here in green, and the cavum septum pellucidum. The transthalamic view is used to measure the biparietal diameter, the vertical dotted line, and head circumference, the circular dotted line. Several important structures are visible in the transthalamic view. First, the thalmi form the shape of an arrow that points to the back of the head. The potential space between the thalmi is the third ventricle, which contains a measurable fluid collection only when abnormally dilated. The cavum septum pellucidum lies between the frontal horns of the lateral ventricles and is the fluid-filled space between the two lamellae of the septum pellucidum. These lamellae resemble two parallel white lines. Sonographically, the cavum is visible between 18 and 37 weeks. Also, the midline falx cerebri is a visible fold of dura in the longitudinal fissure between the cerebral hemispheres. In this abnormal image, the thalmi and falx cerebri are shown, but a normal cavum septum pellucidum cannot be seen. The dotted white lines indicate the normal location of the septum pellucidum, which is not visible. As a result, the frontal horns of the lateral ventricles appear to communicate. Absence of the cavum septum may indicate midline brain abnormalities. These include lobar holoprosencephaly, septo-optic dysplasia, and agenesis of the corpus callosum. Thus, if this finding is noted, additional imaging and counseling are warranted, and amniocentesis is considered.